Thank you so much to the organization committee for selecting me to present this poster presentation. The topic format is this one is treatment of prostate cancer by the interaction of alpha peltatin with the tubulin receptor. That is the natural way, that is the herbal way for treatment of uh, prostate cancer, which is found to be very common now these days in the man especially, which is a slow growing, potentially lethal disease, usually found over the age of 50. Although cases of the disease have been reported in all the age groups, it is found in the tissues of prostate gland. Now, introduction of this topic. In this case, it is a prostate gland is a walnut-sized gland located behind the base of the penis, in front of the rectum and below the bladder. It surrounds the urethra, the tube-like channel that comes urine and that carries the urine and semen through the penis. Its main function is to make seminal fluid, the liquid in the semen that protects, supports, and help to transport the sperm. During the course of prostate cancer, the gland continues to enlarge and can lead to a condition called benign prostatic hypertrophy, that is BPH, which can be better controlled by the interaction of alpha peltatin with the tubulin receptor of our human body. Alpha peltatin is a herbal therapy medication obtained from a plant Podophyllum peltatum. When applied typically, it is a strong irritant to the skin and mucous membrane and can lead to poisoning because of systemic absorption and hence used to treat a vast variety of cancer through high through output screening, and it is also used to highlight the gaps in our knowledge and explore the future research needs for the incoming generation. Now, the methods to which I have selected for this work, that is administered. This treatment is administered to the patient through the intravenous injections. Optical ultracentrifuge studies of alpha peltatin treated tubulin show a small reduction in the 25s to 30s peaks at the 0 degrees Celsius. In electron microscopic studies, the ring structure of tubulin is seen at the 0 degrees Celsius but disappears if the temperature of tubulin incubated with the alpha peltatin is raised up to the body temperature. Now, alpha peltatin repels the replication of chromatin reticulum in mitosis, thereby inhibiting the fast growing cancerous cells of the prostate gland, and thus it will check the growth of such type of cancerous cell. Here I am using Firefly software through the EST method, that is extended Hackle theory method, to get an accurate result in short time interval. Interaction of alpha peltatin with the tubulin promotes receptor independent activation of G protein. Okay, and that is also called guanine nucleotide binding protein that acts as a molecular switch inside the cell and are involved in transmitting signals from a variety of stimuli outside a cell to its interior. It will act from outside to inside, which helps in modifying cell morphology for the treatment of such cancerous cells. Now, come to the structure of this one. Alpha peltatin has been shown. Some active sites are shown at the peripheral side. Okay, with the help of its active site, it is attached to the tubulin receptor and it stop the excessive growth of prostate cancerous cells. Okay. Now, result, it has been found that the dynamics of the tubulin receptor is inhibited through its interaction with the active site of alpha peltatin. The active sites of inhibitor and receptor both has been identified, with the help of which quantum chemical parameters such as softness, ionization potential, electron affinity, electronegativity, average atomic softness, absolute hardness, energy of HOMO, that is highest occupied molecular orbital, and energy of LUMO, that is lowest unoccupied molecular orbital, will be evaluated. With the help of these values, their interaction and efficacy in the treatment will also be better studied. Okay. Now the conclusions. The interaction study discussed in this topic will also be a boon for treating the problems caused by SARS-CoV-19 virus. Even also in the incoming periods, it will be a boon for this field also. Antimitotic drugs such as alpha-peltatin and some other antimitotic natural products show a promising result in the field of prostate cancer therapy. However, the toxicity of these drugs as well as acquired drug resistance allows for an opportunity to develop agents with increased tolerability as well as specificity to the body cell. My investigation has opened the pathway and door of cancer cell resistance to antimitotic drug that will result in the subsequent identification of novel biomarker for future chemotherapy, suggesting increased efficacy in an innovative way for today's such cancer therapy. Now, in this way, I think so that alpha peltatin will be treated as a boon for the treatment of prostate cancer. So, that is the main cause of so many deaths, especially in the men after the age of 50. Okay, some references also have given alert CB groups, and since myself also, my paper is also attached over here for the reference, and Gomila LG's uh, reference also attached with this. So in this way, my paper presented over here. So I think so that you all will like and this thing, and you may utilize it for your further uh, concerns. Thank you so much to all of you for hearing and selecting me. Thanks. Bye bye.